Today we're going to measure hip internal rotation. So to start, we're going to stand on the side of the client, just like we've been measuring some of our other lower assessments. We want to make sure we're using one hand to monitor compensatory movements, the other to kind of guide the limb to measure the range of motion. If you haven't checked out the other videos of straight leg raise or hip flexion, we talk a lot about compensatory movements that happen, but we're going to touch on those here as well. So for measuring hip internal rotation, I always want to say shoulder. I just keep confusing the two. But for hip IR, all right, so I'm standing at the side. I like to control the foot position here, nice strong grip on the foot to make sure we're not getting any sort of compensatory motion at the knee that could potentially influence the hip. I like to take my hand to guide the femur towards 90 degrees, okay? And the reason I like to do that is I also want to make sure I'm not getting any sort of abduction, adduction moment. It just gives me a straight 90-90 is what we're going for. 90 degrees of knee flexion, 90 degrees of hip flexion. Now, a lot of people may also do this in seated, and that's totally okay too, whatever your preference is, as long as you're measuring it consistently yourself. So I'm just going to go move into IR until I kind of hit my end range. Now be very careful going through this, okay, ease into it because some people do have labral pathologies or hip impingement. So if you kind of just go super fast, you might produce a little bit of symptoms. So gradually just ease into it, talking to your client, do you feeling any pinching going on? And then what I'm also paying attention to here is when I get to end range internal rotation, this part of the hip will allow me to keep getting more IR. But in order for it to do that, it's going to hike up. So I can get to IR, okay, roughly about there. And so my oculometer, if this is 0, I'm roughly at about 30, 35 degrees. I could probably get to 45, 50, but this hip starts to hike up and it probably doesn't feel great. Alex is feeling a little bit of pinchy, so I back off and now I have true relative motion there. And that's how we measure hip internal rotation. So you may have noticed, right, I came at the 90-90 position, and a lot of people also do this in seated. So the question is, well, how come I'm moving the foot away from the body? Isn't that external rotation? Well, if I come down and I straighten the leg, it's all just a product of bending the knee, which makes it a little bit funky. But if I roll into IR, okay, this bottom portion of the thigh rolls into IR, okay? The toe rolls in as well. The moment I bend the knee into 90-90, okay, if I spin out, okay, which may be confusing, if I spin out, this part of the thigh is still rotating in. So I'm still getting that IR moment, all right? So can be confusing at times. Okay, I've had that question come in a few times from mentees. Hey, Adam, I thought this is moving away from the body, it's ER. In actuality, because I'm bending the knee, I'm just changing the perception of that. The distal part of the thigh, the whole thigh bone, is still rotating in at this 90 position. Because again, if I do the same thing, pay attention to the leg, if I rotate in, I'm getting that IR measure as well. And this brings me to another point that we can always look at to just double check, right? A very simple gross assessment that you can do is just kind of take the whole leg and rotate it in. Okay, if you're confused, like, hey, I think one side has more IR than the other, this is a great way just to assess. Okay, now you just have to make sure that their pelvis is in a neutral position. So Alex, if you just bend your knees up for me, bridge up. Okay, bridge down, okay, she comes all the way down. We at least control for some sort of normal position of lying on the table. And all I'm doing here is just paying attention to the give, how much IR she has one side versus the other. She's got a little bit more IR on this left side by the ease that I have of bringing this toe down and in versus trying to come in this way, a little bit less, a little bit more restriction. So those are a few ways that you can measure hip internal rotation. I prefer coming the 90-90 in supine. Allows me to control a little bit more, but again, other nuances that you can utilize too to create checks and balances, to make sure you're getting the true measures that you think you're getting. So to recap, one hand on the knee to control for the 90-90 position, other hand at the foot to control for the IR moment. Pay attention to what the hip is doing as you measure it. Feel free to push towards that point of discomfort and then back off to get that relative measure. And now we have our range of motion. Okay, again, use your oculometer, straight line coming through, about 30 degrees there. And that's how we would use that exact test to measure hip internal rotation.